Renal failure. The best treatment options. Kidneys are the organs that help filter waste products from the blood. They are also involved in regulating blood pressure, electrolyte balance, and red blood cell production in the body. Symptoms of kidney failure are due to the buildup of waste products in the body that may cause weakness, shortness of breath, lethargy, and confusion. Inability to remove potassium from the bloodstream may lead to abnormal heart rhythms and sudden death. Initially, kidney failure may cause no symptoms. There are numerous causes of kidney failure, and treatment of the underlying disease may be the first step in correcting the kidney abnormality. Some causes of kidney failure are treatable and the kidney function may return to normal. Unfortunately, kidney failure may be progressive in other situations and may be irreversible. The diagnosis of kidney failure usually is made by blood tests measuring BUN, creatinine, and glomerular filtration rate, GFR. Treatment of the underlying cause of kidney failure may return kidney function to normal. Lifelong efforts to control blood pressure and diabetes may be the best way to prevent chronic kidney disease and its progression to kidney failure. As we age, kidney function gradually decreases over time. If the kidneys fail completely, the only treatment options available may be dialysis or transplant. The kidneys play key roles in body function, not only by filtering the blood and getting rid of waste products, but also by balancing the electrolyte levels in the body, controlling blood pressure, and stimulating the production of red blood cells. The kidneys are located in the abdomen toward the back, normally one on each side of the spine. The kidneys have the ability to monitor the amount of body fluid, the concentrations of electrolytes like sodium and potassium, and the acid-base balance of the body. They filter waste products of body metabolism, like urea from protein metabolism and uric acid from DNA breakdown. Two waste products in the blood usually are measured: 1. Blood urea nitrogen, and 2. Creatinine. Kidney failure may occur from an acute situation that injures the kidneys or from chronic diseases that gradually cause the kidneys to stop functioning. In acute renal failure, kidney function is lost rapidly and can occur from a variety of insults to the body. Since most people have two kidneys, both kidneys must be damaged for complete kidney failure to occur. Fortunately, if only one kidney fails or is diseased, it can be removed, and the remaining kidney may continue to have normal kidney, renal, function. If both patients' kidneys are injured or diseased, a donor kidneys may be transplanted. Prerenal causes of kidney failure are hypovolemia, low blood volume, due to blood loss. Dehydration from loss of body fluid, for example, vomiting, diarrhea, sweating, fever. Poor intake of fluids. Medication, for example, diuretics, water pills, may cause excessive water loss. Abnormal blood flow to and from the kidney due to obstruction of the renal artery or vein. Chronic renal failure develops over months and years. The most common causes of chronic renal failure are related to poorly controlled diabetes, poorly controlled high blood pressure, and chronic glomerulonephritis. Less common causes of chronic renal failure include polycystic kidney disease, reflux nephropathy, nephrotic syndrome, Alport's disease, interstitial nephritis, kidney stones, prostate disease. Signs and symptoms of kidney failure. If unrecognized or untreated, the following symptoms of kidney failure may develop into life-threatening circumstances: lethargy, weakness, shortness of breath, generalized swelling, generalized weakness due to anemia, loss of appetite, lethargy, fatigue, congestive heart failure, metabolic acidosis, high blood potassium, fatal heart rhythm disturbances including ventricular tachycardia and ventricular fibrillation. Rising urea levels in the blood may lead to brain encephalopathy, pericarditis or low calcium blood levels. Kidney failure diagnosed. Blood tests. Diagnosis of kidney failure can be confirmed by blood tests such as BUN, creatinine, and GFR, that measure the buildup of waste products in the blood. Urine tests. Urine tests may be ordered to measure the amount of protein, detect the presence of abnormal cells, or measure the concentration of electrolytes. Other tests. Other tests are used to diagnose the type of kidney failure such as abdominal ultrasound, kidney biopsy. Treatment for kidney failure. Prevention is always the goal with kidney failure. Chronic diseases such as hypertension and diabetes are devastating because of the damage that they can do to kidneys and other organs. Dialysis. Dialysis artificially removes waste products and extra fluid from your blood when your kidneys can no longer do this. In hemodialysis, a machine filters waste and excess fluids from your blood. Kidney transplant. A kidney transplant involves surgically placing a healthy kidney from a donor into your body. Transplanted kidneys can come from deceased or living donors. You'll need to take medications for the rest of your life to keep your body from rejecting the new organ. Medications to control blood potassium. If your kidneys aren't properly filtering potassium from your blood, your doctor may prescribe calcium, glucose or sodium polystyrene sulfonate to prevent the accumulation of high levels of potassium in your blood. Medications to restore blood calcium levels. If the levels of calcium in your blood drop too low, your doctor may recommend an infusion of calcium.